All right, good morning. Good morning. I tell you, it's, for those of you who have been here before, typically we start off at 9. So then somebody had the great idea. They're like, no, let's start at 8:30. So yeah, anyhow, I'm not sure who that was. But it is good to see so many of you here. So for those of you who don't know, I am Representative Dan Miller. You are not in my district. You are just outside of my State House district. This used to be my district when it was cooler. But now it is Representative Deasy's district. And we are, of course, at the Bethel congregation, which has been our home away from home. I think 9 of our 11 summits have been here. And we've always been very blessed to have this congregation support. As you'll see through the day and tomorrow if you're here, they give us pretty well the run of the place. And without their support, it really would never have happened. Because when I came up with the idea, 2013 or 14, everybody said no. We went around to several institutions and they said no, because they said, disability and mental health is a political issue. And I was like, I don't think you're hearing me too well. But we got rejected from like 4 or 5 places. And then one of my staff was like, look, I go to Bethel, so let's try there. And I was like, oh, they're going to say no. But within like 30 seconds of us talking, they knew exactly what we were trying to get at. And thankfully, that partnership has lasted so many years. And so I'm very thankful for them because we get a lot of praise for the event, but it would be very problematic if we didn't have a home for it. So I always thank Bethel, there's no doubt. Look, we want to be sure to go over a couple things just to get the day started. Obviously, we have kind of an exciting day, so I want to be sure to highlight a couple things and then give you guys a little bit of an update. So first, obviously I'm not Governor Shapiro, but he will be here. So I know a lot of people are excited. I'm excited. It's not that we didn't have good discussions with previous governors. I wish they were always cordial. But Governor Shapiro, I'm excited for because as soon as we mentioned mental health, he clicked and said, I'm in. I'm in. And it's a great thing for our state because we are struggling to do a lot. And we need a champion. Some people come up and they'll be like, oh, no, Dan Miller's the champion. Man, you need better than me, all right? And that's Governor Shapiro. So I'm going to be very excited. I hope a lot of you will be here for it to hear what he has to say. You will notice both during the governor's event and throughout the 2 days, there's a little different security that we have to follow. A lot of that is because of the governor and the lieutenant governor who will be here tomorrow. And that's okay. Some of it relates to other things as well. And that's not okay. And every year that we've been here, our friends at Bethel have had to ratchet up and change security. And that is a frustrating and concerning statement of the times that we're in. But you will notice a security change that will happen. So look, we're going to be excited. Having the governor who cares to be here and prioritize this and then sends his lieutenant governor the next day to highlight a couple other points. And you're going to see there's a secretary of labor. They're not here yet, right? Multiple staff from his administration. You see partnerships with agencies like OVR that are all here. You're going to see a lot of the governor's administration. And that's because he cares. And so I'm very excited to have him here at 11. So please, obviously, I hope that you guys have secured tickets to be in here for that. There will be a TV out in the other room. The TV is in the resource fair, literally behind that wall. So if you do not have a ticket, it will be live streaming the governor's talk. It's the best we could do. But it was pretty cool. So I think that should hopefully give you an idea of what he's going to do and talk about. And then you'll see the governor also, he'll check out a couple other things while he's here. So that's good news. Look, on the schedule, we do have one down thing to note, which is the 9 o'clock dating for people with diagnosis, which was a topic I was very interested in. Unfortunately, our presenter 2 days ago developed a bad pneumonia. So I can't help that. We will be actually working with the presenter to do it. We're going to do it virtually when he's able. He's not able today. So we cannot help that. There will be 2 other events that will be going on at the same time. I hope those will entertain you and you'll find it of value. But we obviously could not have the person didn't sound good. Right? You got to let that go. So pneumonia, got him. So we can't do that. So just so you know on the schedule. Otherwise, the day is kind of exactly how we have in mind, and that includes the resource fair. I want to put a plug in for this evening's activities as well. So the evening activities really will kick off. We have our legislative panel on day 1 from 2 to 4. And then at 4 o'clock, we start our art show. And again, don't forget, when we're talking about the artists and musicians, it's everybody. The artists and musicians all have a diagnosis of some type. They're all from the community in some way. So we're going to be kicking off with our art show at 4. At 4:30 is our music performance, so that should be fun. At 5:30 is our transition program, our panel that we have with the AIU that we've been working on with school districts, which is great. And then at 6 o'clock is our very special Future Fair, which is designed to help young people with an IEP start hopefully getting a better idea about what they can do for options as they work into adulthood. So we do have a lot going on tonight, whether you're coming back, whether you're staying, whether you're sending word to your family. It will be great. It will be fun. So that's what we have on tap. And then don't forget, tomorrow we'll be right back here at 9 o'clock, and we'll be starting off with the Lieutenant Governor and our new county exec, Sarah Innamorato, as well. Obviously, as you know, the county is very involved with disability and mental health services in a variety of areas. And so we're looking forward to hear what the new county exec is setting as she also charts the future. I know, if you didn't know, Sarah Innamorato has been here multiple times. I know that she has a personal passion for these issues, so I'm looking forward to that as well tomorrow. So that's what we have on tap, okay? So it should be a good, big, fun day. Obviously, you're in a synagogue. Please keep in mind the rules of the synagogue with it, which obviously limits food and drink. We hope that we've allowed for some flexibility of time, but of course we want to respect our hosts and their faith, so please obviously keep that in mind as well. So that's the not so fun stuff, I suppose, but things I wanted to be sure to reference. Oh, continuing education as well. Like, don't forget, you got to follow those instructions. If you have a question with it, my staff out front can help you. Don't ask me, okay, because I have no idea, right? So don't ask me anything to do almost with anything, okay? So, but continuing education, I cannot help you with. So, but please follow the instructions, because occasionally we get those people a week later and they say, oh my God, I screwed that up. And then my staff, most often, we cannot help you. So please follow if that matters to you. Okay, look, we are sitting here now. It is April, the middle of April. June is coming up. Anybody know what June is in Harrisburg? Budget month. Some nonprofit said that, right? So June is budget month. I want to take a pause while we have about maybe 10 minutes or so here to talk. Look, obviously, it's a big time of year. Okay. So this is where if you don't pay mind on the disability or mental health side to much, just schedule-wise, pay mind to this type of time frame, May into June, because we need to see what type of budget priorities we are going to get across. And I hope that when the governor's here, we're going to also be able to pause with him and get some insight as to his priorities as well. But budget month is coming up. The goal, of course, is that we have to pass a budget by the end of June. June 30th is the deadline. If we can beat it, then hopefully we beat it. But that's what we have to get done. And look, the budget, we talk about priorities. It's also about keeping promises. And that's what we need to see, because so much of what we talk about is really not new programs. Very few times over my 11 years in the legislature have we been talking about new disability and mental health programs. It has usually just been keeping promises. And that's what we got to try and see happen, because our system in so many ways are red flagging in challenges. And to some degree, a fair degree, the bloom has been off of our financial rose. And while we have taken some positive steps over the last 10 years, we are not taking those big, sizable steps that ends waiting lists, that supports DSPs and make sure that providers have a system that works, and they get more people with disabilities into employment, which is a major issue, right? We're still a state, like most states, to which we are struggling to have more than 30 to 35% or so of people with disabilities engaged in our workforce, right? And we're still dealing with too much stigma when it comes to mental health. I'll tell you, the only thing that gives me a little bit hope is this new generation, right? Because whenever I'm at schools, which I was at Upper St. Clair recently, there's always somebody who pulls me aside and asks me a question on mental health. And it is interesting because, especially for those with my generation, we didn't talk mental health, right? This generation will talk mental health. This generation is going to demand changes to mental health. And these are positive things. The question is, how long does it take us to develop a system that meets needs? One of the challenges that gets me upset a bit is on the, we know waiting lists on the disability side, right? Where's Nancy? Nancy Murray, she in here? Yeah. Nance, how many people are on, give me a waiting list number. Okay, 6,016 people on the emergency waiting list, right? 6,016. She could tell you it's 16. Nance probably knows the names, okay? But like she could tell you it's 6,016. How many people are on a waiting list for mental health therapy? Well, nobody knows, right? Nobody knows because there is no system that we are able to track needs. One of the questions that come up with it is you don't know your needs, and how are you developing the system to meet it, right? We know, for example, that we used to graduate 11,000 teachers every year in Pennsylvania. Anybody know how many we graduate now? How much? Who said 4,000? Show off. The treasurer, county treasurer shows up. She's like, I know a number. Yeah, look, it's around 4,000 to 5,000, somewhere in that ballpark. Right? But we know that, and we can also see the demand and the challenges that we have in relation to meeting our education. And the state, unfortunately, for some weird degree, the state's answer is how can we weaken certification requirements or something else. But look, we know how many people we're graduating. We know how our need, we can project it out there, and we can take a look at that. How many mental health therapists of any type, how many social workers do we need? Right? Yeah, now a lot is fine, whoever said that, but it becomes difficult to plan for a lot and to know what a lot means and to know where a lot should be and to know everything else that comes with getting a lot in the game. Because I bump into families and who would tell me stories and they're like, look, I'm on 3 different waiting lists. I'm on 7 different waiting lists. I'm calling everybody to try and get X, Y, and Z, right? Because that's the challenge with mental health, is that we're all over the board, and we need, in my opinion, a statewide direction that is going to grab this issue and lead. And I hope that's something we could talk about with the governor as well, right? So how many people, how do we do it? How do we increase access? We did a telemedicine bill recently too. What can we do on the mental health side? And, especially, by the way, I don't know if you guys come across it, but this anxiety issue, which we're going to talk about here at the summit, has been something to which I love when I bump into people and they say, oh, well, I know anxiety. I've felt anxiety, And I'm like, well, look, brother, there's a difference between you having a bad weekend and you having clinically diagnosed anxiety. Those are not the same thing. It's the same thing with depression. Oh, I've been depressed. Okay, dude, we're not talking about that, right? So the Yankees lost the other day. Yeah, I felt bad. Look, it's not the same, right? Maybe close. But look, so we got to figure out how to do better, right? So these are bigger questions when we're talking about how to develop a system and how to make it DSPs who are out there with it. If you can't afford to do the work, you can't do the work, right? If you can't afford to do the work. And how many times do we talk about a system here that we're not paying enough? If you can make more at CVS or Target, which is fine work, than you can providing life-sustaining DSP work, something's wrong, right? Something's wrong. And when people come up and they say, well, I'm trying to get to $17 an hour and $18 an hour, this is ridiculous, right? There should be no DSP making under $20 an hour anywhere. But by the same token, we have to get the state to do its part, right? Because there's only so much. And yes, we could talk, about things we could talk, we could talk about administration efforts. We can talk about some things internally into some of our nonprofits and even some of our profits. But at the end of the day, the state has to make sure that it's keeping up its part of the bargain. When you create a public-private partnership, you have to have the state meet its responsibility, not underfund it and then complain to the nonprofits in particular and say, well, you guys aren't able to do your work. Yeah, but dude, man, they can't, I'm paying more on gas and I'm duct taping my bumper on the car, right? Which, by the way, my mom did. She was a nurse. So that's what she did. So look, if you're in care of any type, especially in the disability and the mental health side, you've generally been struggling, and it's something that we have to have the state take responsibility for. And it doesn't mean we don't put accountability measures, and it doesn't mean we don't straighten a couple things out, but it means that you have to be able to pay people to do the work appropriately and have them stay in the system, feel like they can be doing the work, make a career out of it, rather than being out the door in 7 months because they just can't afford to do it anymore. You go to Target, you get a discount, right? No discount for DSPs, but you get, 30%. That's not bad. I go to Target. All right. So look, these are things we got to talk about. Look, let me give you a couple other bills here that I want to be sure to highlight, things that we have been doing. For those, and I only mention this just because I have a role in it, look, the disability and the mental health community is always better served when these issues are nonpartisan, bipartisan, where they're not the realm of any one party, right? And that's the challenge a little bit because we are obviously in Harrisburg operating in a partisan world all too often. And that does impact progress. Obviously right now, we have a Democratic governor, a Democratic House, and a Republican Senate. And in a lot of ways, that should bring about opportunities for compromise. By the same token, there are aspects of the disability and the mental health world where I don't know why we're compromising, right? So I'm like, look, either we're funding the system to work or we're not. Either we're working to get people off waiting lists or we're not, right? Because I've had the most liberal and the most conservative family member come up to me and say to me the same thing, which is I just need somebody to help my loved one reach their fullest level of independence and make sure they're safe and secure in the process, right? Or something like that. And so that's the challenge, right? So we know it should be bipartisan and nonpartisan. We know that should be. By the same token, Harrisburg, whether because of our efforts or we're reflecting society, has gotten more partisan in my 11 years, not less. And so even the Disability Summit, to be honest, I used to get more Republicans to come. And I don't mean as people in the audience, but I mean as elected officials. Hopefully that's something we'll continue to work on. But we need it to advance in Harrisburg. And it shouldn't be that any one party, in order to keep a system in place for disability and mental health, has to sacrifice some other partisan, some issue in order to fund the system that impacts everybody, right? There is no Republican waiting list for services, and there is no Democratic waiting list for services. So it shouldn't be treated that way. Anyhow, we do have a couple bills that I've been glad to see move. For those of you who I mentioned employment, the Employment First Commission that we have out there, we made a bill that is going to help them have a full-time staff to be sure they're working on, that they have the support that they need to improve employment opportunities. This is a good thing. Again, that's a nonpartisan commission that's supposed to be is working the best that it can, but it needs that support staff to do it. It's volunteer work, in essence. We got a bill done. It was a bipartisan vote. We're excited about that. And this is a good thing because employment is a major component to what we have not been able to master yet, despite the best efforts of some. We also did a bill on school counselors, right? This also advanced through the House. It was a bill that I wrote and worked with my friend, Representative Mandy Steele. We need, in reality, if I could pick it, the disability and the mental health cost of every school should not be borne by the school districts. They should be borne by the state. Because the problem that comes up in these school districts is, you all know it. I represent Mount Lebanon and Upper St. Clair. God bless. My kid goes to Mount Lebanon, and I know we have members of Upper St. Clair here now. It's tremendous. I also used to represent the city of Pittsburgh. And do you think that the opportunities for mental health supports were the same in Pittsburgh as they are in Mount Lebanon or Upper St. Clair? The reality of it is that we can't have those chasms of opportunities and connectivity. You can't have it, right? Because if you're not providing supports for the kids when they're 15, 16, 17, you're more likely missing it. You're going to find it after problems come up, and your situation is going to be worse. So look, we want to talk about school counselors across the board into school districts. There's no doubt about it. What we have to get to the realization is there are certain inequities that cannot exist. And in the disability and mental health community, that's key. And it can't be one-off. So for example, we passed $100 million to help with mental health services with schools. That sounds great, right? Right? That's 1 year. Then it's gone. Well, how are you building out, especially when you're trying to fight for mental health staff, how are you building out a real program when the state is just giving you enough money to fund it for a year, and then you have to do it entirely on your own afterwards? Again, some school districts can, some can't. Well, that's where we got to get into, right? So that's why, in my belief, is we have to get to the point that disability and mental health needs are covered by the state. It's the only way to be sure that no matter where you are with an IEP or a 504 plan, you get treated the same, you have the same access to opportunities, because it doesn't exist now. So we got to work on that. We also did a bill on digital accessibility. It sounds basic, but we're trying to be sure that your government websites are accessible for every reader. And this is something that came up in the pandemic, right, where we had a bunch of people with a variety of different visual impairments. And if you might recall, during the pandemic, they said, well, look, here's the website. It's going to give you access to where all the vaccines are, life-sustaining. You're going to need to get those vaccines. And then they developed a website that was not accessible for readers, right? Well, that's, of course, ridiculous. So we got to take steps to be sure that type of thing never happens again. We have another bill that we're going to talk about with Schedule A, which is a federal effort here on employment. We're working with the administration on trying to find the pathway through with that. We're also trying to pass, we did pass, the Behavioral Health Commission's report entirely, the recommendations entirely for mental health. These are 5 big efforts that 4 of them are done through the House. One of them, we're on the verge, I think, of finding a pathway through. But they're all going to be knocked to the Senate. And if you like any of them, and it's one of the things we're going to continue to talk about, then hopefully you'll call the Senate. Because you know how many disability and mental health bills are coming from my friends in the Senate right now? None. Right? So the House is doing it. But disability and mental health cannot be the purview of one party. And if it remains the purview or stays or grows to be the purview of one party, then everybody in the community is going to suffer from that. And the system will as well. So, I should have ended on a positive. Yeah. All right, look, we're so excited that you're here. This is my favorite event. Okay, and we're so glad. You're going to see some 20 different members of the House of Representatives, the Senate here. You're obviously going to see the governor. If you're here tomorrow, you got a big group coming, Lieutenant Governor and Sarah Namarato. We're more and more surprises we're trying to do. We got a great evening program. I want to thank again everybody. First off, thank you all for coming in so early. Thank you for being here and being here throughout the day. I want to thank my staff for all the work that we have done and we're going to do for you today. I think the parking's going to work out. If it doesn't, just blame Steph, and that will be fine. So, but we are excited to have you. So look, 9 o'clock, remember, there are 3 sessions, but only 2. Please now, because of the, what was it? Yeah, the illness, pneumonia. I apologize. So plan that out. We'll be back with 3 and 10 o'clock, and the governor at 11. We're so excited. Thank you for being here. We look forward to talking to you throughout the day, okay?